Hey there and welcome to the channel. If you've never been here before, let me introduce myself. My name is Andre Huey and I'm a physician assistant and I work in the emergency room taking care of patients. In this video today, I'm going to talk about stroke-like symptoms, what to expect when you get to the emergency room when you have stroke-like symptoms, and stay tuned to the end because I'm going to tell you about a condition that you can have which gives you stroke-like symptoms, but it's not really a stroke. It's really important to remember that it's up to a medical provider to determine where your symptoms are actually coming from, but you'll be interested to hear about what this situation is, so stay tuned to the end for that. Really quickly, subscribe to my channel. That would help me out greatly. And let me stress that if you are having any kind of worrisome symptoms of a stroke or even a heart attack, stroke-like symptoms or chest pain or shortness of breath, time is tissue. Call 911 and get to the emergency room immediately. Do not use this video to make the determination of what to do. All right, so let's just jump right to stroke-like symptoms, and the medical community has done a great job in educating everyone about what those symptoms are and the importance of getting to the hospital quickly for those symptoms. So I like to keep it simple and just say that if you're having a severe headache, especially if it's anything out of what is normal for you, if you're having a change in your vision, such as a loss of vision or a blurry vision, if you're having confusion, difficulty speaking, maybe you're having some dizziness and you're having trouble walking, any kind of numbness, tingling, or weakness of your face, or numbness, tingling, weakness of your arms or legs, anything like that, you should get to the emergency room right away by calling 911 to be evaluated for a stroke. So when you do call 911 or when you get to the emergency room for stroke-like symptoms, if you call 911, which you should, and the paramedics get there, they will key in on your stroke-like symptoms and they will call ahead to the emergency room to let us know that you're coming and we'll be expecting you. And we will ask you a series of questions about your symptoms very quickly, and we will do a quick physical examination as well. And the same thing will happen if you come in through the lobby. Say you come in by private vehicle, and the nurses in the triage area, they will key in on the fact that you're having stroke-like symptoms. They will bring you back very quickly. We will ask you questions about your symptoms. We will do a physical examination, ask you to do certain things like smile and talk. We will check your reflexes, your sensation, the strength in your arms as well. And then we will make a determination, do we need to activate something called a code stroke, where that gets things done very quickly. So the evaluation and the workup for a stroke is that you will get blood work to look at all of your blood counts, your electrolytes. More than likely, you could get some heart enzymes done as well, an EKG, but then you will also quickly get something called a CT scan of your head, possibly vascular studies of the vasculature in your neck and your head as well to look for blockages, and more than likely you will get an MRI of your brain done very quickly also. All of this to be done very fast to determine what type of therapy, what type of intervention needs to be done if you are having a stroke to reduce your chances of having a lifelong or long-term deficit, neurological deficit from the stroke. So again, that comes in to me saying time is tissue. Get to the emergency room as quick as possible if you're having any of these worrisome symptoms. So those are the stroke-like symptoms. That is very quickly the evaluation that you're going to get done in the emergency room to determine, are you having a stroke, the imaging, the lab testing to be done. So if you are having a stroke, you will be admitted to the hospital for further treatment and workup for that condition. So let's talk about what type of a condition you could have that would give you stroke-like symptoms when it's not really a stroke. And that is something called Bell's palsy. That is when a virus called the herpes virus wakes up in your skin and it attacks your facial nerve, and it's going to give you a facial weakness that mimics a stroke, but it's not a stroke. Now let me caution you here. It's not up to you to make that decision. It's up to a medical provider. So call 911, get to the emergency room, and let us decide, are you having a stroke or is this something called Bell's palsy? But Bell's palsy, the herpes virus, affects the facial nerve. It can cause a facial weakness on one side, numbness, tingling on one side, eye drooping, facial, or I should say mouth drooping, maybe a funny feeling on one side of your tongue. But those symptoms can be treated if you get to the emergency room in time. Sometimes you might get an antiviral for that. If we think it's Bell's palsy, sometimes you might get steroids, but that type of therapy is determined by the medical provider that is seeing you at the time. So again, really quickly, we talked about stroke-like symptoms. What's the quick evaluation and workup that you're going to get in the hospital for that? If you are having a stroke, you're going to be admitted. And then what is the condition that you can have stroke-like symptoms when it's not a stroke? I want to thank you for tuning into this video. I want to ask you kindly if you'll subscribe to my channel, like and share this video with everyone, and check out other videos that I've got links to up above on my channel with other conditions and things that go on in the emergency room, and I would appreciate it very much. Thank you so much for tuning in. Take care.